Well, good afternoon, and thank you once again for joining us here for an update on COVID-19 across Dubbo and the Western region. Joined today again by the CEO of the Western New South Wales Health District, Scott McLaughlin, the Assistant Commissioner and Western Region Commander for New South Wales Police, Jeff McKechnie, and from the Australian Defence Force, Colonel Warwick Young, who's overseeing this COVID response from the ADF perspective. We had some great news yesterday afternoon, which we'll touch on, which is all of the pop-up clinics, which will be happening right across the region starting from tomorrow. We'll have more to say on that in just a tick. Up until 8 o'clock last night, 27 new cases have been reported for the Health District. 21 of those are in Dubbo, 2 in Bourke, 2 at Gilgandra and 2 at Gadooga. So across the Health District, the total number is now 194 active cases of COVID-19. Scott can talk a bit more about the breakdown of that when he addresses you. An important message today is around the vaccination pop-up clinics, and I think there's much expectation and excitement around that starting tomorrow. With that comes, I guess, a bit of responsibility on everyone as well. So West Dubbo, Pioneer Park, tomorrow morning, Saturday through until Sunday, the 29th of August. We have that running between 9 and 4:30. That is a walk-in clinic. You do need to be prepared for a long wait there, there's no doubt about that. There will be marshalling. I should mention Dubbo Regional Council Mayor Stephen Lawrence is here and the GM as well. Council's been working extremely hard with police and also with the Health District to make sure that everything is covered off tomorrow for that to work as well as it possibly can. There will be crowds there. We're asking you to take some water, take a hat, put on sunscreen, make sure you're thinking about food and people you might have with you. There will be toilets available. There will be lots of people there to help you make it as good an experience as it possibly can be. But given we've seen lineups for testing, we would expect there will be lineups for this clinic tomorrow. Please do be prepared for that. From Monday, we have the ADF team and supported by Health going to numerous locations, starting in places like Bourke and then moving right across the district as well. We will have some more details on exactly what those locations will be and exactly what those times will be in the coming day or so. Again, all of that information is being worked on. There are local emergency management teams that will be meeting again today that will start to reach out, and Jeff can talk a bit more about how that will happen. But if you are in a location and you've had confirmation that your town is included, we want you basically to be ready to be in town on that day and be ready to get vaccinated. Wellington is having its own dedicated clinic. So that's a really important step forward, starting from Monday, this coming Monday the 23rd. Hours will operate between 10 and 4 on Monday to Friday. That's a collaboration between WACS, the Wellington Health Service and Hospital, and Swift Street Medical. So they will be doing a separate clinic to what is already occurring at Swift Street and already occurring at WACS. Those two will continue with their vaccination programs, and this new clinic will be a collaboration to make sure that more doses can get into arms as quickly as possible. Now that will be happening at the WACS car park. Entry is off New Street at Wellington, and that will be starting, as I said, Monday morning. Bookings are essential, and that's a fairly simple thing to do. It's a phone number to call. So no online bookings at the moment, a phone number to call, and that is as simple as 6845 5423. That information is also in this post. That line is open right now. I spoke to Kathy not too long ago. There are already calls coming in. That's what we want to see. It will take a little time to book you in, but that is the way to do it for all residents at Wellington, starting Monday for Pfizer, if you're eligible, and the other clinics are delivering AstraZeneca, which will continue. And there's also a plan for Swift Street Medical at some point to do a mass vaccination clinic on a weekend for AstraZeneca. So that's great news. Wellington is certainly being looked after really, really well. Again, that phone line will get very busy. Please be patient, keep trying it, and you will eventually get through. Also, good to note that there are more appointments popping up all the time at the vaccination clinic that's been run by the Health District in Dubbo, as more and more people become available to get their jabs elsewhere, more and more appointments becoming available. So if you want to book and have it at the clinic, they're now doing jabs 12 hours a day. Do it through the online booking, the eligibility checker, and more of those appointments, as I say, are happening each and every day. Venues of concern obviously continue to grow. It is almost impossible to keep you updated verbally or on Facebook, but they are the places to keep an eye on. Is the New South Wales COVID update. That updates literally at least once a day, sometimes twice a day. We will keep putting links there on all of our social media pages. Keep checking that, and if you do need to get tested, please do. Testing numbers have been good. We want that to continue, and again, Scott can talk a bit more about that, along with sewage testing, which has been continuing and will continue across some of our smaller districts. Police activities are ramping up. We've had a few incidents at supermarkets. They're being regularly checked, and Jeff can also talk about the fact that from midnight tonight, that permit system comes into play for all visitors from Greater Sydney across regional New South Wales. It doesn't actually change what happens. There is a requirement to actually need to come to a regional area for a particular reason to come right now, but when that permit system kicks in, you will need to have a permit, and that's all available from Service New South Wales. Essential shopping, as we've talked about before, if you are at the far end of an LGA, you can go into another LGA if that is the most simple, most effective and safest way for you to keep all of us safe. So you can do that. Be prepared to be asked a question by police officers if you are in another local government area, but if you are there for a very good reason, medical or essential shopping, that will be fine if that is the closest place for you to go to. And look, schools are continuing to operate as needed. There are very low numbers of students attending, which is good. Very low numbers of supervisory teachers needing to be there, which is also good. But of course, if you do need to have somebody at school, that will always be available, and we're making sure we do the very best we can there. And the other thing, of course, is just to keep doing what you can. The messages we're providing here, they go through all of our mainstream media, our social media channels, but you're a part of the equation here. Please use your networks, your connections with people to spread the messages we're talking about here. It's really important because not everyone is connected the same way. We need you to show support. We need you to show love. We need you to provide those messages as clearly and concisely as you possibly can. So thank you for your support. I'll hand over to Scott now for his update.
Thanks, Dougal, and good afternoon, everybody. Again, another really concerning and sobering day with increasing case numbers in Western New South Wales. To 8 p.m. yesterday, we saw a total of 27 new cases identified. That takes us to a total of 194 across the local health district. In those new cases, 21 of those were in Dubbo, of which only 3 were infectious in the community, and so that's a decreasing number, and that's a positive sign. Burke, 2 cases, none of those were infectious in the community. Gilgandra, 2 cases, only 1 of those infectious in the community. And Gadooga, 2 cases, only 1 of those infectious in the community. That's a change that I think is impacted by the stay-at-home orders and everyone starting to stop moving around as much as possible. This is the most crucial thing that we can do at the moment to stop the spread of COVID in our region. In terms of our total cases, we've seen a change in the demographics in the last couple of days. So we've now got around 50% of the cases are under 20 years of age. 90% of our cases are under 50, and so still a big proportion of the number of cases are younger people, the vast majority under 50. We now have 1 person aged over 70. We've now got 4 patients in hospital. 1 of those is in intensive care and ventilated. That's a patient in Dubbo. We now have 177 patients in our care in the community team. That's a specialist team going into homes to provide support for both patients with confirmed COVID cases and others in the household with other chronic and ongoing illnesses. There's a rapidly growing number of venues of concern across the whole of the region. 89 in total, 70 in Dubbo, 11 in Mudgee, 2 in Orange, 2 in Bathurst, 2 in Burke, 1 in Walgett and 1 in Gilgandra. Now we've speeded up the process to identify and communicate those locations of concern, so can I please urge everyone to keep an eye on that New South Wales Health COVID website for that information. It is updated on a regular basis. We'll continue to communicate that as quickly as we can. In terms of sewage testing, we've now got a significant number of communities that will be tested into the future. That's been a positive step in the last 24 hours, and I'll go through those communities in a second. But in the last 24 hours, we've seen more positive tests in new communities across Western New South Wales. across Bathurst, Parkes, Dubbo, Cobar, Narromine and Coonamble. Can I please urge everyone in those communities, please come and get tested as an absolute priority. Any signs and symptoms, however mild, please come and get tested really urgently. The other sites that will start or have started testing, Walgett, Brewarrina, Condobolin, Cowra, Forbes, Oberon, Coonabarabran, Nyngan, Blaney, Molong, Galargambone, Wellington, Gilgandra and Warren. So there's some positive steps there to extend our tentacles to try and figure out where COVID might be lurking across Western New South Wales. We'll come back and update of any positive sewage tests come out of those locations. In the last 24 hours, we saw a further drop and a significant drop in the testing rates across the region. We only saw 5,300 people come forward for testing yesterday. Now that's nearly half the rate of what we saw only 2 days ago and for the vast majority of the last week. And so with COVID spreading across nearly every community in our region, we know it's out there. We know that it could be your neighbour, you or your kids that is the next person to infect your family or your neighbours and other people around you. So please come forward and get tested as quickly as possible. Stay at home and don't circulate and don't mingle with other people as much as you can. The numbers in communities across the last 24 hours, Dubbo 2,700, Mudgee 951, Bathurst 165, that's a significant drop in Bathurst, please come out and get tested. Orange 449, Parkes and Forbes about 80 odd each, Wellington 62 with the sewage detection in Wellington. I'd urge please come forward and get tested in Wellington. In Burke 105, Gilgandra 88 and Narromine 95. Testing will continue right through the weekend for all of our locations and right through next week, so please come to those locations for testing. Today we've set up a testing clinic up in Gadooga given the positive cases, and so today and tomorrow Saturday and Sunday, 10 a.m. to 2 p.m. Please, for the whole of the community, come out and get tested at the health clinic in town, and 9 a.m. to 4 p.m. Monday to Friday, right throughout next week. In terms of healthcare isolation, we've now got 131 staff off in isolation at the moment. That's a little increase from yesterday. We're still managing all of our services quite well, and so thank you to all of our staff that are doing just amazing things to help provide care to patients right across our region. Vaccination, again, more good news with the Defence Force kicking off tomorrow in Dubbo with the mass vaccination hub that'll see, I'm sure, a lot of people come to walk in to get both the Pfizer and AstraZeneca vaccine. So please come forward for your vaccination, and not just tomorrow, Sunday, and right through all of next week at the grounds in West Dubbo. We will have we've got a vaccination clinic up in Gadooga today that's run by Oka Health, so can I please urge the community of Gadooga to come out and get vaccinated. I know the Aboriginal Medical Services up there last week doing some vaccination as well. Wellington, as Dougal announced, will have a dedicated vaccination hubs over the next 2 weeks in Wellington. The number will be on Dougal's website on our information, so please everyone come and register for a vaccination at those clinics. We'll have both the clinic dedicated to Pfizer and a clinic dedicated to AstraZeneca, so can I urge the whole of the community and communities surrounding Wellington come out to get vaccinated. I might pause there, everyone. This is again another really concerning situation. We're seeing further spread across the region. The sewage detections for us are a real concern. Please, everyone, assume that it could be you, it could be your children, your neighbours, or anyone around you that isn't symptomatic yet. It could be infectious. You could be spreading it yourself unknowingly. You could be picking it up from someone that you stood behind in the supermarket line, the service station line, or anywhere else in the community. Please, everyone, stay at home. This is a really crucial time for us to stop the spread of COVID in our region. Thanks. I'll hand over now to Deputy Commissioner Jeff McKechnie.
Thank you, Scott. Good afternoon, everybody. Picking up on a couple of Scott's points right from the start, I guess. over the next little while here in Dubbo, two of the reasons you can be absent from your house, one of them is to have a vaccination and the other one is obviously to have a test. Both are really important at the moment, and we need everybody we possibly can coming along from tomorrow at Pioneer Oval in West Dubbo and getting that vaccination. It's going to be well structured, there'll be plenty of parking, you'll park and walk in, there'll be plenty of people there to help you. But as Dougal said, bring some water, bring some snacks for the kids, bring some food. We will make it as seamless, as quick, as painless as possible. And we just urge everybody who wants to get vaccinated to come along. Bear in mind, that process is going to be there for the next 9 or 10 days. No one is going to miss out on a vaccine. There's going to be plenty of time. Don't panic if it's a bit chaotic tomorrow and you think you don't need to involve yourself in that. Come back the next day or the next day or the next day. It's still going to be there. So please avail yourself of this fantastic opportunity for us to get our people vaccinated here in Dubbo. Scott mentioned the testing again. Come down. It's quite lawful for you to leave your home to come down and get a test if you're feeling at all unwell. If you think you've been exposed, come down. The line is so short, it's taking 10 minutes to get through. Come down and get a test, please. We need to get those numbers back up, not just in Dubbo, but right across the region. It's the only way we find out where this virus is spreading in the community. Our great friends from the ADF have joined us, and Colonel Warwick Young will talk to you shortly. But between us, we've come up, and health, we've come up with a strategy around vaccinations right across the western part of the state. The virus is being spread by people moving from place to place. We can track its movement, it's quite clear. So we are putting a program of vaccination around all of our locations that we can get to over the next 8-10 weeks. And again, it's going to be first and second vaccines. So the ADF from tomorrow here in Dubbo, and then from Monday in more far-flung western locations, will be out there giving the Pfizer vaccine again to anyone who wants it. We are going to publicise those locations as much as we possibly can. We'll get them up on all our social media sites, everything we've got, and we need you as well to spread the word when they're coming to your town, to get your relatives there, get your friends there, get your colleagues and workmates there to line up and have that vaccine. Again, no one's going to be left behind. There's plenty of time, there's plenty of vaccine, and we'll make sure everyone that wants one gets a vaccine through that process. So please help us out with that. It's, again, an incredible opportunity for us here in Western New South Wales. We're seeing lots of cases right across the region, and that's because people aren't abiding by the health orders. They're not staying home. Here in Dubbo, in the past 24 hours, 60 infringements again. And it's all locals in our towns, in Dubbo, moving around without a reason and being detected by the police and having that ticket issued. Please, we are following up with the issue of those tickets. We're trying to put a process in place where after those tickets are issued, we actually follow up with some support and some advice from community members to those people who receive the tickets. We're trying to get to everybody just to try and shore up that process and make sure the message is getting through appropriately, that you can't be away from where you're living at the moment. If you're staying with someone, you need to stay there. Please, stay put, don't move. We've had some questions about caravanners again. If you're in a caravan travelling through this region at the moment, you need to stay put. Stay where you are, or alternatively, if you live in New South Wales, make your way home. There's only two choices. You can't be touring around Western region in your caravan. Stay put or go home. Some tickets being written out for caravanners as well right across the region. The local government boundaries issue is still out there. Again, reasonableness has to be applied. If your town's across the boundary, but that's where you go for your shops, that's the closest place, then of course that's where you need to go to get your groceries. In conclusion, can I again just, almost plead with people, please stay home unless you have a valid reason to come out, and the valid reason this weekend here in Dubbo is to get a vaccine. I urge you all to take up that offer. Thank you. I'm happy to take any questions before I hand over to Colonel Young. If anyone's on the line there that needs to ask me something specific.
Thank you. We've got a couple of people. We'll start off with Emily Wheeler from the Liberal. If you have any questions for Jeff McKenzie.
Hi Jeff. I have a question just about the regional permits which come into effect tomorrow. I understand that the website, the application process isn't actually up and running yet. Have you firstly had many people, coming from Sydney or trying to enter the region? And secondly, how's that going to be policed?
No, we haven't had many trying to get in, Emily, from outside the region, and nor should we. Look, there are still static sites checking permits. If you get pulled over by the police, you may well be asked to produce that permit. But really, unless there is a really compelling reason, we wouldn't think too many people will be taking up that offer at the moment of coming out to this part of the state. And if they've got that reason, they make that application online, and that pass that will get them through to wherever they need to go.
Any follow-up then?
Just a quick one on supermarkets. I know it's been mentioned a couple of times about police, just trying to help out in shopping centres. Are there any specific examples or any anecdotal examples of how, what people are doing at supermarkets?
No, look, I think it's just that impatience, intolerance that sometimes creeps in. Sometimes there's a lack of courtesy towards other people, which obviously we totally discourage. There's no need for poor behaviour from anybody. The supermarkets are open, they're normal hours, there's groceries on the shelves. Please just take your time. Again, be tolerant of others. I've noticed long lines around the parcel pickup and click and collect and all those sort of things. Again, in those lines, you just have to be tolerated. If that's the way you want to do your groceries, you may well be sitting in a line for some time. Again, be prepared for it. Have what you need to do that, or do your shopping in a different way.
Thank you, Jeff.
Next, we'll have Claudia from Prime. If you have any questions for Jeff.
No, I'm all good, thank you.
Olivana from Channel 9/Win. No questions, righto. And then we have Alex from the ABC. Any questions for Jeff?
Yeah, I do have a couple. Quickly, I wanted to ask, have there been any compliance issues with the quarantine facilities in the region?
No, they haven't. We are assisting health with a couple of locations where we are placing folks that need to be kept in different accommodation for whatever that reason might be, and we've had no issues at all with that thus far.
So is that you haven't had problems getting people into the facilities, or have you not had problems keeping people in those facilities?
No, we've had no problems keeping. I haven't heard of any issues keeping anyone in those facilities. The vast majority of them are there by choice, recovering from whatever their illness is, and the health people are doing a great job of looking after them, and I'm sure those people are pleased to be receiving that assistance largely.
Any other follow-up questions? Otherwise, we'll let Jeff go and we'll get Channel up to say something next.
Excellent, thank you.
Welcome everybody The ADF has continued to do the tasks in the last 24 hours that they've been doing in assistance for the New South Wales Police. That's the community engagement, the assistance with wellbeing checks, and also assisting them with the tasks that are making people do the right thing. The vaccination teams have all arrived now into Dubbo. They're conducting some preparations today, and from tomorrow they will start providing vaccinations to the community. So if there's any questions, please ask.
We'll kick off with Em again.
Hi, Colonel Young. Just in regards to your community engagement, how is that, I guess, out of Walgett and those remote communities? Has there been any resistance, or how are you finding it?
We don't have any ADF in that role out at Walgett. There will be some moving out to Burke and Wilcannia from Monday, but there's no ADF currently doing that task in Walgett.
Okay, how about out of Wilcannia and Burke? Is there sort of community engagement that happens ahead of you guys going out, or is that looked after by another department?
That will be looked after by New South Wales Government, and I imagine the same engagement that I had the other day with the local community leaders will continue, and they will prepare the community for us coming out to assist them in the same way that we're doing it here in Dubbo.
Great. Em, we might come back with Claudia. Do you have any questions?
Yeah, Colonel Young, I guess just can you talk us through the role of the ADF personnel at vaccination hubs over the next 8 to 10 weeks, and I guess what they'll be doing on the ground?
Sure. The teams that we've provided, the vaccination outreach teams, are clinicians, and so they will be delivering the vaccinations to the individuals and supporting New South Wales Health in that. Of course, the New South Wales Police and New South Wales Health have the lead, so they will prepare the schedule, but we're providing the manpower in the delivery.
Thank you.
We'll go to Olivana from Channel 9/Win. You'll just need to unmute your own microphone, Olivana, if you can hear me. No? Okie dokie then. We will go on to Alex from the ABC.
Nothing for me, thanks.
All right. In that case, I'll open up the floor for any other questions. We've got a few more minutes and some time if there's any others.
I guess just for the member of Dubbo, there was a cross-cabinet meeting last night discussing whether Dubbo needed to go into further restrictions or whether it needs to be declared a hotspot. Can you talk us through why a decision wasn't made to go ahead with that?
Oh, look, there's been discussions. There will continue to be discussions around what needs to happen, not just for Dubbo, but the entire state. And what has come to the fore is some of the restrictions that are being placed around Greater Sydney, and that will include notably that all people anywhere, including in regional New South Wales, will be wearing a mask apart from when exercising from Monday. So there was a lot of discussions with police that has basically taken up most of that space, and of course curfews for Greater Sydney. So that was some emergency decisions that had to be made there. I've had another discussion with the Deputy Premier this morning. I don't believe at this point in time, I spoke to the Chamber of Commerce yesterday and several different businesses, different types of businesses around what a hotspot upgrading might mean. The feeling from me on the ground at the moment is that whilst it will help some people, for some people they're feeling it's not the right time to do that. So I guess we're still discussing it literally every day. That will probably continue. And if and when the timing is right, that's when a decision would be made.
Thank you.
Alex, you have your hand up for a question.
I know the wonders of technology. I've got a question for Scott McLaughlin. It's in terms of the Narromine case we were notified of. I think it was a couple of days ago now. We were notified there was one case in the community that was they weren't infectious in the community at the time. Now
As I understand, the cases that have been identified in Narromine are still in Narromine. The further contact tracing helped us to identify whether people were in the community symptomatic and infectious, and so those are the changes that continue to happen. The more our contact tracing team understands when a person first became symptomatic, infectious, and do the tracing of where they've been. So we'll continue to update that information as it comes to hand.
And I've just got a quick follow-up to that one as well. Gilgandra now, pardon me, Gilgandra now has 3 cases at the moment. Are you concerned about people providing incorrect information to New South Wales Health, and are you confident in your contact tracing?
Well, sometimes our contact tracing takes a number of conversations and quite extensive conversations, and so our teams are working 24/7 to try and help people understand when they've become infectious, where they've been, what they, who they might have been in contact, and help us to get in front of any further spread. So I think our teams are doing a great job. I know people in Gilgandra are concerned about the potential for community spread. Can I please urge everyone to come out and get tested as quickly as possible? Gilgandra is definitely a community of concern for us.
Thank you.
Thank you.
Hi Scott, it's Claudia. While you're there, I've got a couple of questions. One, just in regards to the vaccination hubs. How many doses are going to be at each hub? Is it going to be up to the population number?
So we're forecasting around 10,000 doses a week will be delivered both through our local health district current hubs, the ADF vaccination teams, and some other providers that are coming into the region, the likes of the Wellington program. And so around 10,000 doses a week of Pfizer and more of AstraZeneca. And so we're pretty excited that that'll help us skyrocket the rates of vaccination in the region.
And just in regards to the cases at the moment, what's the percentage of the Aboriginal population that are an active case at the moment?
So around 65% of the cases right across the whole of the region are Aboriginal. In the last 24 hours, we've seen further cases identified, obviously in Gadooga, Burke, and Dubbo that are Aboriginal.
Thank you. That's me.
Hi Scott, just have a question about the 1300 number. Have a lot of feedback from people who cannot get through continually. Are there enough? Obviously not enough resources. Can it be more resourced? Is there another way for people to get in contact?
So we had half a dozen new staff start in the contact centre yesterday. That they've taken a record number of calls in the last 24 hours. I know a lot of people are getting through and getting advice and guidance around any of their concerns, and particularly helping us to follow up the pathology results. We know that some of the pathology providers have had long waits over 72 hours. It's pleasing to know that the Lavity results are now coming back, the vast majority within 48 hours. Some that were taken 3, 4, 5 days ago have been prioritised to the top of the list. So we are seeing improvements there. I know people are wanting information and needing that for a whole range of reasons. So please keep trying if you do need to get access to that advice.
Okay, and just a question about the vaccination hubs as well. Are there still plans to put in a vaccination clinic at Dubbo Showground, and is there any timeline for that, if that's still the case?
Yes, we're definitely progressing plans around both a drive-through and a walk-in program in Dubbo. We're just finalising the location and some of the other arrangements around that. We'll have that information available early next week. In the meantime, the Dubbo vaccination hub at Monera Plaza is still available 12 hours a day, 7 days a week. And so please, the people that have been registering and booking in for that, we're fast-tracking a lot of those vaccinations now that we've opened it up longer hours.
Great. If there are no other questions, we might leave it here and let's got prepared for the next press conference.
Sure. Thanks, everyone.
That's it. Thank you so much.
Thank you.